Thank you very much, United Kingdom. And I call on Argentina to be followed by the Philippines. Argentina, you have the floor.
Muchas gracias.
Thank you very much indeed. As our President, Alberto Fernandez, has said, nobody will get out of this alone. And we are very aware of the socio-economic damage that is affecting the whole world. And that's why we need to work together with an integrated approach, attempting to implement measures to enable us to mitigate the negative impact on our communities. Protecting human life must be our primary focus. In order to work in a multi-sectoral manner, Argentina created the General Coordinating Agency for the Integrated Plan for Preventing Public Health Emergencies of International Concern, coordinated by our Chief of Cabinet and led by the Ministry of Health. Within that framework, we very quickly adopted health, social and economic measures to try to contain the spread and the impact of the new coronavirus. On the 22nd of January, just 1.5 months after the first case was registered, Argentina issued an epidemiological alert. And just a few days later, we started to check passenger arrivals and recommend isolation of passengers arriving from affected areas. In less than 10 days after the detection of the first case, we issued the order for a closure of borders. We recommended preventive self-isolation, remote working, and school closures at all levels, and indeed the cancellation of public events and other measures. After 2 weeks, we established preventive and mandatory social distancing across the country, and that remains in force. The Ministry of Health has been coordinating with all of our provinces, strengthening our capacities for prevention, detection and response within the healthcare system. In under 45 days, we had 21,850 new beds, 1,452 of which were in intensive care units, 5,466 general beds, and 14,907 isolation beds, 1,181 ventilators, 200 portable scanners, 12 modular hospitals, and 4,000 healthcare professionals. We also created a national equity fund to guarantee comprehensive coverage for all of our people. We work together with the Ministry of Industry in order to strengthen the national production of essential supplies, doubling the capacity for the production of ventilators and converting part of our textile industry to produce PPE, personal protective equipment, with a view to strengthening the capacity of technological development, human resources and diagnostic and research equipment. We created the Coronavirus Unit, through which we promoted 3 major national developments: the use of saliva as a sample in order to replace cotton swabs, a serological test to detect antibodies, and the use of plasma from recovering patients as a treatment. Furthermore, Argentina has been invited to participate in the multi-country solidarity study being run by WHO. Argentina wishes to indicate its interest in moving forward with any regional or global initiative designed to strengthen measures to combat the pandemic. And any initiative helping us to get access to the results of research into treatment, vaccines or medical products. What we need is for states to encourage work to guarantee access to knowledge of these global public goods through free licenses or sufficiently accessible ones for societies all over the world. We will win this battle with the commitment of everybody. It's not just up to governments, it's a collective responsibility. And we are convinced that any measures being taken at national level must be in coordination with the international framework. in order to get out of this crisis and face this new reality, we need to design and sign up to a global solidarity pact. Thank you very much indeed.